Yo, what's up everybody on YouTube? My name is Leon Johnson, aka Sleeping Ghoul, and I'm a tattoo artist in Brisbane, Australia, and I specialize in dark style tattoos. In this video, the topic is about tattoo infection, and I'll be discussing how it can happen, what to look for, and how to prevent it, and how you can go about treating it. Just a quick disclaimer, I'm only a tattoo artist, I'm not a medical professional or a doctor or anything like that, so I'm only speaking from my own experience as a tattoo artist, tattoo collector, and my own research. So if you want an accurate professional answer in this topic, you should go ask a professional in this field. So tattoo infections basically happen when bacteria or germs get into the tattoo. It can happen during the procedure or during the healing process. The fault could be either the tattoo artist or the client who gets the tattoo, or it can be just a case of bad luck. I'll start this off with where the tattoo artist could be at fault. During the tattoo process, there's multiple needles penetrating your skin thousands of times. So a tattoo is an open wound, and there's a safe amount of depth that the needle can go into the skin and the amount of times that the area can be worked over. So if your tattoo artist goes too deep or overworks the tattoo, the skin is basically damaged beyond the safe amount. And this could result in the skin being destroyed, causing a greater wound, and this could potentially lead to scarring and increase the risk of an infection. And also, if a tattoo gets overworked or gone too deep, whether it does or doesn't get an infection, it will most likely take much longer to heal and cause big scabs to form and have a bad healing result in the end with patches of ink missing. So from what I've seen, the most common times when a tattoo gets overworked is when the tattoo has solid packings in it, whether it's black or color in small or big areas. Solid packing is very difficult to do, especially for an inexperienced artist. So hygiene and sterilization is extremely important in tattooing. If the artist doesn't follow through the standard hygienic and sterilization practice, this can result in a client getting an infection or even worse, a virus. Things like ink and needles and other stuff that's going to be used in tattooing need to be sterile or disinfected. Otherwise, if contaminated, this will increase the likelihood of an infection happening. Other things like if the artist doesn't wash their hands before setting up or tattooing, or if they're touching dirty things with their gloves that they're going to be using, like their phone or something, then germs and bacteria will get on their gloves that's going to be fiddling around with your open wound. So touching things with their dirty gloves they're using to tattoo is a very bad thing. Like if they're grabbing ink bottles that aren't wrapped up, or grabbing and ripping off paper towels off a roll and then putting it back on the table, or if the nozzle of their ink bottle is dipping into the ink cap that's being used to tattoo, anything like this is cross-contamination, and this will increase the risk of someone getting infected with a virus. So these two things are basically the cause of an infection when the artist is at fault: poor tattooing technique and hygiene issues. So now I'll get into when the client could be at fault. When the client is at fault of a tattoo infection, it's because of bad aftercare. Generally, your artist will give you advice and instructions on it, but I would say tattoo aftercare is pretty much common sense. The basic rules are to keep your tattoo clean and don't touch it with dirty hands or anything like that, and use the right aftercare cream and don't put too much on it. The first few days of getting a tattoo is the most important time because it's a fresh open wound and germs and bacteria can easily get into it. But keeping it clean doesn't exactly mean washing it every hour. Keeping it clean means to wash it when needed and not touch dirty, unhygienic things, like touching it with your hands, laying in bed sheets, or if you have like a pet dog, try and keep it away from touching your tattoo because they aren't exactly all that clean. Other things like swimming with a fresh tattoo is a terrible thing to do. There's so much bacteria and other whatever stuff swimming around in the water that's going to be very harmful to your tattoo. There have been cases where people have gotten an infection after swimming and died from it. So please keep in mind that hygiene is the biggest thing when it comes to aftercare and to keep your tattoo clean. So there are other things that can cause or increase the risk of an infection where it's neither the fault of the artist or the client. So the areas you get tattooed can have an effect on the healing process and have a higher chance of an infection or irritation, like elbow ditch or knee ditch, feet, armpit, or groin kind of area. From what I've seen and experienced myself as well, is when it comes to like the elbow ditch, like this area, it is quite prone to like infection or irritation. I've had a mild infection on this area as well as many other people that I know has had complications when it comes to healing this area. I'm assuming it's because you bend your arms all day long and things can get in there and get trapped in there pretty easily. Other areas that I just mentioned are quite similar as well. They also sweat and rub a lot, which can risk like irritation and infection. So if you catch a sickness like right after you got tattooed, or you were sick when you got tattooed, your immune system is already working to fight off whatever you were sick from, which can compromise the healing process of your tattoo. So other unavoidable things are like other people touching your tattoos, because for some reason some people think that's okay to do. Your job is also something you should take into consideration. If you can take 2 or 3 days off, that would be great, but if not, just be conscious of it. Allergic reactions can happen, and this can cause irritation or infection. Usually this happens with colors and most commonly with red ink. So symptoms you need to look out for an infection are redness, inflammation, bumps on or around the tattoo, and worsening pain. And when it gets bad, discoloration, fever, pus and other fluids coming out of it, and open sores developing. So most of the time infections are easily treatable, usually with some antibiotics. It does depend on the severity of your infection though. If it's mild, it can probably go away on its own or with some antibiotics. But if it's severe, you may have to do multiple antibiotics or be hospitalized. I'll list out a few things that can result from a bad tattoo infection: a terrible scarring, sepsis, your skin rotting off, having to get an amputation, or even death. So obviously these are when an infection is left untreated for too long. So if you notice your tattoo is infected, go seek medical attention. As much as tattoo infections sound scary, don't be discouraged from getting tattoos. Infections aren't all that common. Just do your research on your tattoo artist and take care of your tattoo properly, and it will be fine. Thank you for watching this video. I hope you enjoyed it, and I hope you have a good rest of your day. Please like it, subscribe and all that stuff.